On MIPS measures 5 and 8, can we use code 3022F to indicate when a patient's LVEF is greater than 40% and the patient does not meet the denominator qualifications for these measures? Or would we leave these unanswered?
Well, great question, Julie. Of course, for all those who aren't can't rattle off those numbers off the top of their heads, MIPS measures 5 and 8 regard left ventricular ejection dysfunction or left ventricular dysfunction and depressed ejection fractions. Julie, for those two measures, we want some way to exclude patients with only mild left ventricular dysfunction. The ICD-10 diagnoses for left ventricular systolic dysfunction, LVSD, or heart failure, are not adequately specific. They really encompass all levels, mild, moderate, and severe. Medicare is asking you to report only on those with moderate or severe LVSD, and you must exclude those. Well, might not be an adequate the right word. It's beneficial to exclude those with only mild LVSD. I can't imagine I can imagine Medicare downgrading your submission for including mild LVSD, but it would actually hurt you in your scoring if you miss the interventions in someone with mild LVSD. It's irrelevant to the reporting. So if you include them in your denominator, you'll get a lower than deserved score. And none of the ICD-10 codes, reflect mild differentiate between the severities. And of course, they've also got a numerical level to it, looking for LVEF, that's left ventricular ejection fraction, being less than 40 is moderate, and those above 40 are mild. Now, so you can accomplish that differentiation either by delivering a number, the actual measured left ventricular ejection fraction, or if you grade it as mild, moderate, severe, give us that grade, or whoever's doing your reporting for you, deliver that grade, and in the logic, we can exclude the milds in any way. But there has to be a way of delivering that. And it isn't just the code you put on your billing form, because none of them are specific enough to mild, moderate, or severe left ventricular dysfunction. Now, an adequate way to do it is with the code 3022F. Now, that's called a QDC code, or a quality data code. Medicare publishes QDC codes on the specifications for every measure to cover either the performance met, not met, or an exception, or even the sub levels within that. And 3022F is such a code that indicates that the patient does in fact have left ventricular ejection fraction problems, or left ventricular systolic dysfunction, but it's only mild. Or the other measure actually uses the codes M1150 or G8923 as to indicate that it's moderate or severe dysfunction. So you can use those codes. They're not pertinent in your LCD-10 coding, and they're not typically used in the language of any reporting or anything in the EHR. But particularly if you're building a system using your claims data as part of your data collection and delivery system, those are quite effective ways to use it. And I would recommend using Medicare's standard codes. Even though you never deliver these to Medicare, you deliver these codes to your registry, and they use them to help determine which patients should be included and which excluded from your denominators. So a lot of different ways to do it. We pride ourselves with trying to make the best of your strengths and weaknesses. So when you engage with us to do those kinds of measures, we will help decide for you what's the easiest way for you to deliver accurate data so we can deliver for you an accurate and the best possible score that you can deserve.